Hi, my name's Samantha. I'll be your nurse today. What's your name?
Patience first.
Okay. And your birthday?
5/25/95.
Wristband, you're good. Today I'm going to be performing your head to toe assessment on you, okay?
Mm-hmm.
All right. So before we get started, I'm going to raise the bed to working height. Gonna make sure that it's locked, and it is. Sorry, I'm going to provide privacy first and then sanitize my hands. Alright, so first we're going to start with your level of consciousness. Obviously the patient is alert and awake. And do you know who you are? What's your name?
Patience first.
Patience Bird, great. And do you know where you are today?
Yep, CTC.
Okay, and what time of day it is roughly?
About 9.
9, good. And do you know why I'm here?
For the head to toe assessment.
Good, okay. I'm going to look at your eyes first. So you just wear glasses. Do you wear any contacts ever?
No.
No, okay. I'm gonna check your conjunctiva first. Good. That's good, okay, and they're both pink and clear, which is good. I'm going to look at her pupils next. So when I do this, just look at me, okay?
Yep.
Good. Okay, her pupils were equal, round, and reactive to light, both the left and the right. And when I put the light in, it restricted, which was good. And do you wear any hearing aids? Are you hard of hearing?
No.
So unaided hearing. I'm gonna look at her ears. And pull the pinna up and back. Good. Gonna come around to this side. Bring it up and back again. She's good. And she had a good, healthy amount of serum in there in the left and right. We're gonna do your hand grips. Can you squeeze my 2 fingers? Good, and then go like this. All right, and don't push me. All right, and try not to pull me. Okay, good. So she's good there. We're gonna do your feet. Well, the hand grips for push and pull, they were both equal, which is good. We're gonna do the feet next. Can you push down like you're going to gas pedal? And then bring them back to your nose. Good. All right, and do you have any pain today at all?
No.
All right. If you was like a 0 out of 10, what would you rate it?
0.
0, good. All right, and her skin color and tone is good for her ethnicity, so the color's normal. She's not pale, sweating, or anything. I'm gonna check your 2 radial pulses. Can you go like this?
Mm-hmm.
We have a watch on. No. All right, good. She's palpable on both left and right arms. I'm going to look at her capillary refill now. Can I see your fingers?
Mm-hmm.
She's good. Took about like 1 second. Healthy. So that's good. And then I would do her toes, but she has socks on, so we're just gonna. Both of them were brisk, which is good. I'm gonna look for any edema present. I'm gonna poke you.
Okay.
And she's good. Edema is absent. And do you have any calf tenderness, like in your left or right?
No.
Okay, good. All right, and I would take her apical pulse and her respiration. Her heart sounds are regular. The patient doesn't have an IV. Next, I'm going to listen to your lung sounds, okay? Can you just sit up for me if you don't mind?
Yep.
I'm gonna start with the back first. Good. 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 Oh. She's good. Now we're gonna go to the front. Good. Now I'm gonna go under. Good. Good. All right, now her lung sounds are both clear, which is good. Now I'm gonna have you lay back, okay?
Mhm.
I'm gonna lay you flat.
Yeah.
And how many times would you say you urinate a day?
Probably like 6 to 8.
6 to 8, wow, good. Alright, good. So the patient said 6 to 8 and she's continent, good. I would look at her teeth first. I don't know why I put her back, but I can still do that while she's laying down. So do you wear any dentures or anything? Any troubles with your teeth?
No.
Good. Okay, I'm gonna look at your inside of your mouth, okay? Good. Great. It was a good color, pink, and it was intact and moist, not dry or pale. And I would look for the non-distended abdomen. She seems to be good. So the patient's abdomen is non-descended and it would be soft, which is good. We're going to listen to the bowel sounds now. All right. So the bowel sounds for all 4 quadrants, they were present, which is good. I can check that off. Any problems with your bowel movements?
Mm-mm.
And when was your last bowel movement? Do you remember?
Yesterday.
Yesterday, okay. And what would be the color of it?
Brown.
Brown, good. Any abnormal sizes, or would you say it's normal?
Like a large. Nothing abnormal.
Okay. And the consistency's good?
Yep. Formed.
Next, I forgot to palpate the abdomen, sorry. That's good. Sorry, I forgot that. My bad. So it's good that. Okay. And obviously during this whole procedure, the patient showed active range of motion and passive range of motion, so she's good. And do you use any assisted devices like a cane, walker, or crutches?
Nope.
She's good. And how often do you go for a walk, or are you good at walking? You're
Yeah.
able to walk. And
Yeah.
how far would you say you're able to go?
I get my 10,000 steps in.
Oh wow, great. And she tolerates good walking distance. She's good. And she's a low risk for the Braden scale, I would say. Any risk for falls? She has the bed alarm and stuff like that, so I don't think she has side rails too. I would say she's a low risk. For the skin, I would say her skin is intact and there's no rashes, bruises, lesions, or scars or anywhere. I'm going to check your skin turgor on your clavicle. I can sit you up now, sorry.
Okay.
Just left you hanging. Maybe you're tired.
I am. I can see.
Alright, now I'm going to check your skin turgor on your clavicle. Alright. Good. She's not dehydrated, which is good. And it came back in 1 second, so she's good. And I did it on the clavicle. And I would say her skin is a nice warm, not hot or cool, so she's good. And her skin is dry, which is good. And do you have any abnormal sleeping patterns? Are you sleeping more, sleeping less? Any difficulty sleeping or
No, I would say normal.
normal? Good, okay. How about your concentration? Would it be decreased concentration, increased, or pretty normal?
Normal.
Normal,
Yeah.
good. Any mood changes recently, like anxiety, suicidal thoughts, fatigue?
No, just stress from school.
Stress. Okay. So sleeping disorder, I would say no. Incontinence, no. Skin breakdown would be no. Problem with feeding or eating, no. Confusion for the patient, no. And evidence of falls, no. And in the nursing notes, I would just put that the patient has some stress from school that she's dealing with. And then I would sign my name, and that's all. All right. Thank you so
Thank you.
much. I'll come back and check on you in about like 30 minutes or so, okay?
Okay.
Thank you. Oh, and I would lower the bed, I'm sorry. Lower the bed. And give you your call bell too. And then I would come back and check on her in 30 minutes. And then I would sanitize my hands when I'm done. That's it, thanks.